Some communities in rural Queensland have built an adequate workforce by employing doctors and paying an annual salary. Under the salary model, doctors are employees of the Public Health Service. It's a simple structure on the surface, working in the same way as any professional industry where a company employs a team. Doctors are leased out to general practices, which are run either by an independent practice management company or, in the very small towns, by the Hospital and Health Service. Queensland Health recruits doctors by advertising and interviewing candidates. Doctors work a standard 40-hour week for an annual salary, with overtime paid as extra. Under the industrial award structure, doctors are not legally allowed to receive bonuses if they exceed their billing quotas. The remuneration is generous, exceeding the potential earnings under the Medicare system. This makes it an attractive option for GPs. But money isn't the only incentive. Because doctors within a region work for one employer, there's a team mentality despite the geographical spread of staff. They feel professionally and intellectually supported and can consult their colleagues in the corridor or over the phone. This model enables the workforce to offer employee benefits you might expect in corporate environments, like paid maternity leave. This can be absorbed by a large workforce, whereas it would be challenging to provide this in a small practice. Many new doctors are also active parents and want the option of working part-time. The salary model enables this flexibility, which is a big departure from the traditional rural workforce model. It's also easy for doctors to move in and out of rural practice, giving them flexibility as their careers or lives change. Rather than becoming practice owners tied to a rural location, they can structure their careers without the big financial investment and commitment. This model enables a workforce to experiment with different clinical systems and structures. There are benefits to the community too. There is a consistent approach to patient contributions above Medicare rebates. This can make the difference between a patient seeing a doctor or not, and also whether the doctor's practice is financially viable, especially for those in severely drought-affected communities. The Medicare system still applies under the salary model. The Commonwealth Government reimburses the general practice each time a doctor bills a patient. The Hospital and Health Service retains that money and pays a percentage to the practice management. There's a shortfall between the funds generated by the doctors and their salary. The Queensland Government covers this expense. It's important, therefore, for doctors to bill their patients accurately. Incentivising this accuracy is an ongoing challenge. This model has enabled one rural region in Queensland to grow from 5 doctors to 20 in just 5 years. And the best thing is that doctors feel supported and satisfied in their jobs.